Good health and welcome to today's Black Health Now edition of the Wellness Watch, sponsored by the African American Wellness Project. We have a tremendous opportunity today to talk to our special guest, Dr. Rodney Hood, on the slave health deficit and post-traumatic stress. 1430. Good health and welcome to today's edition of Black Health Now, a segment of the Wellness Watch sponsored by the African American Wellness Project. We're extremely fortunate today to have as our guest Dr. Rodney Hood. Dr. Hood is the author of an online digital article, The Slave Health Deficit and Post-Traumatic Slavery Stress Disorder. But this is just his article. He's been discussing this and researching this for many years. And it talks to us about our history, talks about how our history reflects on our health. So I want to welcome Dr. Hood. Welcome to our program. Dr. Hood is the past president of the National Medical Association and the chairman of the Multidisciplinary Council in San Diego, California. He has been a true champion for health equity and for improved health services for all people. Dr. Hood, welcome to our program. All right,
Thank you.
The slave health deficit and post-traumatic slavery disorder. Tell us a little bit about how you got interested in this topic.
Okay. First of all, thank you for having me, Dr. Lenore. And I would like to say that this article is actually published in the Journal of Racial and Ethnic Health Disparities online. I encourage you to download it. And it starts with an American story of a health system dilemma. And I think that's important because when we start talking about slave health deficit and post-traumatic slavery stress disorder, people just think of Black folks. But this is American history that I think has not been told or especially understood. So please read the article. So to address your question, the purpose really is to develop an enhanced understanding of the historical foundation and the current racial disparity. So in essence, I'm talking about what happened in the past and trying to explain that what happened in the past is still affecting us today through behavior, through physiological responses that we're still experiencing because of our experiences in America. Specifically, slave health deficit was something I learned from public health specialist Dr. Michael Bird and Linda Clayton when they wrote their book, talking about and documented how health disparities for Black folks started back in slavery. And they looked at every decade up until current times and showed that we've always had deficits. And the question was why? Early on, the history states that they said Blacks, slaves, had these deficits because they were inferior, mentally and physically. But the truth was, the reason wasn't that. It was because of the conditions they were living under. Today, we call them social determinants of health. There is also something I talk about, PTSD, post-traumatic slavery stress disorder. I use that term because there's a term PTSD, post-traumatic stress disorder, that everybody has. But I think the intergenerational, and what I mean by that is the stress that exhibited and that our ancestors went through generations ago. We're still experiencing some of that today.
So you're saying that from my perspective, is that there is a certain amount of stress that we feel that has passed through a number of generations and is being manifested today in the health of Black people.
So what I'm saying is that it's not simply I'm feeling my ancestors. That's one way to look at it. I'm really looking at the science. This is the science of racism. This is the science of stress, in that through the centuries, there have been certain structural environments, and specifically healthcare, that have created an environment where Black folks don't get the same health treatment and health outcomes as others. And then it's not just the health, it's the other structural environments that have not always been conducive for Black folks that continually put us under stressful situations at a higher rate than other folks who are not Black because of racism. And we are now beginning to be able to measure that. So we can actually measure this stress and show that what I'm saying has some merit.
Can you give me some concrete clinical examples where the manifestation of certainly the kinds of things this disorder passed through generations manifest itself today? And maybe in some patient examples.
Yeah. Well, how I started coming upon this is there is a cardiovascular risk calculator that has been adopted by the American Heart Association and the American Cardiology College, in which it will put your risk factors in this formula, and it will say, here is your 10-year risk of having a heart attack or a stroke, looking at your blood pressure, looking at your cholesterol, whether you have diabetes, whether you smoke. Well, about 15 years ago, they added race. So now they use that plus they add race. And there was one 50-year-old African-American man, real patient, that had an elevated blood pressure, cholesterol, and I clicked African American, and his risk was 25%. Without changing any other numbers, I changed his ethnicity to white male, and it went down to 15%. I said, well, why is that? It didn't ask, was he educated? Did he have an MD degree? It just said at those numbers, there was a 10-point drop just by being white. I said, what would those same numbers be if this was a Black female? And the risk went up higher than the Black male to 27%. And when I changed it to white female, it went down to 7%. So what is happening here?
That's so critical because it doesn't just happen on the calculator. Clinically, plays out an increased maternal mortality deaths, increased deaths from almost every chronic disease without any evidence that there is a genetic difference between Blacks and whites. We see this all over the place. Is this a manifestation of the slave health deficit, or is this a manifestation of the kinds of systems, health systems America's perpetuated that put Blacks in a position to be engaged in these kind of clinical responses?
So what you just said explains the slave health deficit. So in essence, what I'm talking about, there's a deficit ever since slavery. Nobody's really been able to adequately explain why it's been so persistent. And so that's what this paper talks about. Why is it still so persistent? And I think you talked about death rates. I think you can talk about disease and disease burden that Blacks have, but the bottom line is it causes increased death rates, premature death rates for Blacks, much higher. There was a recent article that came out just in 2023, and they looked at the past 20 years and said that based upon health disparities, 1.63 million excess deaths in the Black community took place because of health disparities, which is equivalent to 80 years of life, 80 million years of Black life lost. So I equate that to modern day lynching. Now, I know that people might think it's hyperbolic, but if you look at the history in this country, one of the health disparities in the 20s and 30s was lynching, that the National Medical Association and other organizations were involved in trying to stop because it was happening more in the Black community. Well, my point is, it's still happening today, but I think our Supreme Court Justice Clarence Thomas once said, high-tech lynching. And I want us to look at those numbers and say, why is that still happening? But more importantly, what can we do about it? Um, and 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 if we're talking about what we can do about it, I first need to get a huge understanding as to what caused it.
Now, let me ask you a question because it's not quite clear to me. Why do you think it's still happening?
I think it's still happening for many reasons. There are our system, our health system, our legal system, our justice system, our educational system have unfair, discriminatory policies and practices that have created an environment that is difficult to overcome those barriers. Now, I talk about a funnel. You look at the Black community, there's 10, 20% of Black folks that are able to get through that funnel in spite of those obstacles. And what happens is people look at folks like myself or you and say, well, it didn't prevent you from becoming successful. But what about the other 90 or 80% when we compare it to others? And even if we are successful, Black professionals and Black physicians do not live as long as their counterpart. Why? Because even at that level, they're still dealing with racism and racist structures, no matter what level they're at. Infant mortality and maternal mortality is higher with Black women and Black babies for decades. Why? Even if the woman has good income or in a different economic status, her maternal mortality rate is greater than white, Hispanic, or Asian. And I'm saying there's this chronic stress. There's this thing that us Black folks don't like to talk about. Okay. Some of us have some negative internal views of ourselves. I I tried to give a definition of what I called white supremacy. I called it dysesthesia caucasoid myopia. Read it in the paper. It
Can you say that again
dys-
slowly?
dysesthesia caucasoid myopia. Dysesthesia means some type of disease, there's something wrong. Caucasoid, because in the paper I point out how the term Caucasian came about because some gentleman in 1700 found a skull near the Caucasian mountains and said, it's a European skull, it's the most beautiful, more beautiful than black or brown. Okay. There was racism in even naming that. And myopia means short-sighted, very narrow-sighted. So that to me is, and when uh, folks who have dysesthesia caucasoid myopia, it's a mentality. And I'll explain to you what I mean by mentality. I think it should be a pathological diagnosis because not only whites, some whites have that mentality. Some folks that look like us have that mentality. And how could somebody like us have that mentality? That's that internalized racism.
Is that the same? Is that the same as unconscious bias on the part of the healthcare system or the physicians that take care of us, or
Yes,
even us against ourselves?
yes, yes. And there are tests now in which we can measure unconscious bias. And that test now has done over 1 million individuals. And they've done enough by categories. There's a study that actually showed physicians in general have more of an unconscious bias towards Black folks than other professionals. That's surprising. Okay. When they looked at a breakdown of the physicians by race and ethnicity, not only whites, but Asians had a very negative unconscious bias of Black folks. The ones who had least bias were Blacks, especially Black females. Very little bias, according to that study.
But you know, I've been a physician a long time, and there are even some Black physicians who have that same unconscious bias as a result of their education and training, to the point where they believe that the patients that they're seeing are of a certain socioeconomic group or racial group are not the patients they solicit.
So let
I've
me
seen
give
it
you a
happen many times.
let me give you a confession. When I first, this is over 10 years ago, when I saw that, I took the test and I didn't tell anybody what my results were because I had more unconscious bias than I thought I should towards Black folks. Okay. And but I've been researching this so much. I've taken the test several times, and because I've researched it so much, when I took the second and third time, my bias level went down. So you're right. Many of us have this bias and don't realize it. And what I'm telling you, uh, mine wasn't at the level of whites or Asians, but it was higher than I thought it should be. So that let me feel there's something internal that many of us assume just because we're of color, we don't have that bias.
So, what are the key points you want people to understand before we start to talk about how we address this very serious clinical problem?
Well, I think the key points is know your history rather than his story. Understand your history will help you better understand what's happening to you and us today. And that will create a situation where we'll have better solutions. Okay. So again, I put, as the introduction said, I've been talking about this for 30 years. And I've seen it evolve to the point when I first started talking about this, they said, well, how do you measure racism? How do you measure stress? And at that time, they did not have measurements or ways to measure. Today we do. And it's confirming what I've been talking about for a long time. You asked about a patient. I have a patient when I give a presentation that I use as an example of PTSD. He's a patient in my practice who, when he came to me, had severe claustrophobia. Put him in the room, closed the door. He got very upset, started hollering. This gentleman was 58 at the time. He had diabetes, he had hypertension, he had suffered a stroke. He was on a lot of medications and very anxious, but very claustrophobic. Finally, I asked him, why does he always want the door closed? He told me it took maybe about 2 or 3 visits before he felt comfortable telling me the story. I actually have it on film. And he described when he was living, I think it was Arkansas, and at 7 years of age, he was kidnapped from his house, taken to the woods by the Klansmen, and he witnessed 2 Black men getting lynched, and they were getting ready to lynch him after they tortured him, put him in a duffel bag, put snakes in there, buried him for a few seconds before he suffocated, pulled him out. And he said, that's why I don't like to have the door closed. He had a twin brother who didn't go through that, but was a alcoholic, but didn't have all those diseases. Somebody 58, how he came to San Diego was he had relatives in San Diego to get away from that.
All right, let me ask you a question now, because obviously we could go into more detail, but that's why you've written the article. For people who are interested, every Black person should be interested in delving into more detail as to the origins of this and understanding how we got where we got. In just a very few minutes that we have left for our interview, how are we going to deal with this? I mean, as doctors, how are we going to deal with this as patients? How are we going to deal with this as a people?
Yeah. So I think, first of all, in the end, I make several policy and clinical, I call them remedies. I start off with medical health reparations. What do I mean by that? Most folks think of reparations as getting a check. It is, to me, reparations is how do you, if this is because of the culture and system we've been in, we need to start repairing our health. And I think more resources need to go to the historical Black colleges, not only medical school, but colleges in general need to go through. They should be giving programs like you have, Dr. Lenore, more money so more folks can hear it. And the other is we need to start taking care of our mental health and physical health and taking it seriously. I talk about trauma-informed care, where we need to start realizing that. So, for instance, if there are many articles now that say that they diagnose post-traumatic stress disorder more frequently in whites than they did in blacks, and if blacks had abnormal behavior or things were happening and they were black, they got a different diagnosis: schizophrenic, bipolar, etc. Well, the treatment for those are certain medications, but many times with PTSD, we need other types of therapy and treatment. So if some of the issues are because of that, then we need to start talking about trauma-informed care and learning what that means. And I discussed that at the end of my paper.
Well, I think that certainly this is a very critical topic for our nation to understand, as Americans, for Black people to understand where they are and why we have so many unique problems based upon generations of the kinds of care that we didn't get. And so consequently, I want to thank you, Dr. Hood, for this article. The article, Slave Health Deficit, Post-Traumatic Slavery Stress Disorder, a must read for anybody who sees our program and share with your friends. So Dr. Hood, thank you very much. So this ends today's edition of Black Health Now, the news segment of Wellness Watch, sponsored by the African American Wellness Project. And we always end our program with the same statement: health is your biggest asset. Let me do that again. Well, this ends the interview with Dr. Rodney Hood, something that each of you, if you have any kind of time, should access and delve into and read to understand where we are as a people, where you are as an individual Black person within the context of American health. We always end our program with pretty much the same statement, and we believe it to be true, that health is your biggest asset, so please protect it.